The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Good day to you. Welcome. Glad to have you here for the next episode of TMD Demystified. I am Tony Urbanek. Today's episode is entitled Night Guards and TMD Revisited. Night Guards and TMD Revisited. Because I have a prior episode on this podcast, which is entitled Night Guards and TMD. But we need to revisit this issue because there's been some progress made on the facts of the matter. And it's interesting how it has rolled out. It is not the best example of what needs to come, but it is an example that the universe is cracking. The dental universe is cracking regarding this issue, the problem, the conundrum called TMD, temporomandibular joint disorder. Actually, this is my 216th episode of TMD Demystified. I record them every Tuesday morning. I'm very methodical and making sure that it's done every Tuesday morning. The date today is August the 26th, 2025. But the message that I deliver about the temporomandibular joint disorder, singular disorder, it is not multiple disorders like the gurus want to say. This episode is just an example of the progress that we're making. So let's kind of proceed in this manner. I'm going to go through a synopsis of my prior episode very rapidly. Unfortunately, I'm going to read it. Bear with me, which will describe the state of use of the night guard for the past 70 years, at least 70 years. The night guard has been the first line of defense in the dental practices, promoted in dental schools for temporomandibular joint disorders, known in the vernacular as TMJ, but accurately as temporomandibular joint disorder, singular, not multiple disorders. So let's get through the synopsis first, and then we're going to talk about the progress that we've made on this issue, bringing out the foolishness of using a night guard to treat TMD. So the synopsis goes something like this. In a previous article, I discussed what dentists call night guards and their relationship to treat temporomandibular joint disorder, TMD. In summary, 50% of dentists make a night guard for patients who think they have TMD. If the dentist is asked how a night guard is helpful in treating TMD, they will mumble something about it decreases the amount of clenching and grinding of the teeth. Dentists call clenching and grinding of the teeth bruxism. So they say night guards decrease bruxism, and everyone knows bruxism is related to TMD. That is a fact. That is a fact. That is a true statement. Bruxism is related to TMD. We just don't know the mechanism of bruxism. We don't know exactly what happens within the central nervous system that creates bruxism. We do know it is related to anxiety and stress and worry. That is what creates bruxism, but we don't know what happens and how that is related within the central nervous system. To continue, it is a true statement that bruxism is related to TMD. It is one of the three circumstances that cause damage to the temporomandibular joint, TMJ. Once the joint is damaged and does not heal properly, the inflammation within the joint converts to chronic inflammation, stimulating the symptoms of TMD. What I discovered was chronic inflammation creates all the symptoms, and exactly mechanically, physiologically, pathophysiologically does that. Both the painful and non-painful symptoms of TMD are created by chronic inflammation. To continue, but night guards only protect the teeth from damage caused by bruxism and have no guarding effect on the TMJ. In fact, most people who have been told that night guards are used to treat TMD report that wearing a night guard increases the TMD symptoms. That is what I have seen in my estimation and my practice for 50 years. People come in with a brown bag full of night guards, and they say, actually, when I put this in, it hurts more. It is a strange fact that dentists are taught that night guards are used to treat TMD, yet they increase the symptoms of TMD. 50% of dentists prescribe night guards because they think they must do some kind of treatment to satisfy the patient when they are hoping the patient doesn't return because in their experience, they know night guards are not effective for treating the problem. The other 50% of dentists who don't prescribe night guards don't want to treat TMD at all because they think there is no solution for the problem and want nothing to do with it. So 50% of dentists use a night guard, 50% don't want anything to do with the TMJ patient, the TMD patient. And then there are a few TMD gurus who use smoke and mirrors to treat TMD, hoping the medical insurance companies will pay for their nonsense. That's a very small proportion of dentists. I would say probably 1/100th of 1% of dentists I would classify as a TMD guru who use smoke and mirrors and different varieties of diagnosis and treatment, at very best only trying to treat symptoms rather than the cause, and then try to get medical insurance companies to pay for their nonsense. That is a summary of my previous episode, and I stand by it. I stand by it. But the reason that we did this episode, which is the Night Guard and TMD Revisited, is because a recent article, ironically, came out in a dental magazine. I would not call it a journal. It is a magazine. We call them throwaways because you don't keep them. They're not scientific journals, but they are well read. Dental Town is probably one of the most widely read dental magazines that are generated and written for dentists. And this is the August 2025 issue, volume 26, issue 8. And in this issue is an article they entitled "The Use of Night Guards Revisited." And it's written by Doctors Barry Glassman and Don Maligzia, who I do not know personally. I don't think I've ever met them. But in this article, among other things, and there's some things in this article that I disagree with, but this is the first article, whether certainly nothing exists in the scientific literature, but in any dental literature, I mean, any dental literature that I've ever come across that clearly states that the night guard should not be used to treat TMD, TMJ problems. So I wanted to kind of discuss that a little bit because they are very honest about this. This episode is my number 216th episode on Dental Town, the same organization that publishes this magazine. And the platform that I use to publish my podcast is the Dental Town platform. So I would have to assume that doctors Glassman and Malizia are at least passingly familiar with some, if not all, of the 216 episodes of TMD Demystified that I publish on the same platform where their article was published. So now in the August 2025 issue of Dental Town, one of the most widely read magazines in the dental community, an article was published by doctors Glassman and Malizia. And within the article is the following statement regarding night guards. To quote, the appliances regarding night guards, the appliance's effectiveness is limited to protecting the teeth and does not extend to the underlying causes or symptoms of joint or muscle dysfunction. Well, that's very direct, very clear. And now, ironically, we have at least two other doctors who are published on Dental Town that agree with the simple fact that if you have TMD, TMJ problems, the last thing you want to prescribe is a night guard. The problem, ladies and gentlemen, patients and doctors listening, is that it is currently not a problem finding a dentist in the United States of America who will happily prescribe you a night guard if you present to their office with the diagnosis of TMD. If you tell a dentist that you think you have headaches and earaches or jaw pain or any of the other symptoms coming from the temporomandibular joint, there is a 50% chance you will be prescribed a night guard in August of 2025. So we have a disparity. We have a disparity, a conundrum on the agreement within dentistry about night guards. Now, I have talked about why and how night guards should not be used, why they're not effective, really. It's just they're not effective. That's the reason you shouldn't use them. And in many, many cases, they actually make the symptoms worse. And they make the symptoms worse because you are applying forces right through those night guards, and night guards take up space between on the teeth themselves. So you're applying the same amount of force on the temporomandibular joint that damaged it in the first place. And sometimes, because the night guard surfaces are raised, covering both the anterior and posterior surfaces, you're increasing the forces on the temporomandibular joint that originally damaged the joint due to bruxism. I mean, no one disputes that bruxism can damage a temporomandibular joint. It's intuitively known. And there is good science behind that also. It is intuitively known and scientifically proven that clenching or grinding, clenching during the day or night, or grinding, which is motion of the teeth, day and or night, can damage the joint, just like too much force or motion can damage an elbow or a hip or a knee. Orthopedic surgeons know about this greatly. Why do knees get damaged? Well, there's acute damage, injuries, falls, athletic injuries, but there's chronic injuries doing the same thing. They just injure the joint slowly rather than acutely. So you can acutely damage this joint, but most patients damage the joint due to chronic overuse of the joint, and bruxism is one of the three circumstances that causes extra loads on the joint, overuse of the joint, that eventually causes this little joint in front of the ear to break down. That is bruxism. Scientifically proven, intuitively known. No one disputes that bruxism causes joint problem, disease. What is in dispute, obviously, is how do you treat that? And I don't know what better word to use, pandemic of using a night guard to treat it that doesn't work and actually makes it worse. Fortunately, the dam has broken, at least a little bit. I wouldn't say the dam is broken. I take that back. There's cracks in the dam. There's cracks in the dam with this article. This is the very first article I have ever read, observed, come across in my 50 years of studying temporomandibular joint disease, both directly with my own scientific endeavors and indirectly by reading others. This is the first article that I've come across that actually says, don't use night guards because they don't work. Don't use night guards because they don't work. But yet, right now in 2025, I can tell you that 50% of the dentists faced with a patient that has a TMJ diagnosis, whether it's generated by that dentist or generated by the patient coming in and says, I have TMJ, please help me, a night guard will be prescribed. And actually, most of those dentists who prescribe the night guard know that a night guard is not effective. Most of the dentists who prescribe those night guards actually hope the patient doesn't come back. Now, I have discussed this issue personally with hundreds of dentists, maybe pushing 1,000 separate dentists in the last 20 years. This exact same issue of the night guard versus TMD, and explained to them or stated to them or told them that my experience with the night guard shows it doesn't work, and my experience with the dental community, the dental industry, that 50% of dentists prescribe a night guard and 50% of dentists don't want anything to do with TMD because they know nothing works. Not a single doctor has ever questioned that, disputed that, or argued that with me, that statement, because they are familiar with the problem called TMD, and they are familiar with their colleagues and what the colleagues do. And no one has ever disputed the fact that 50% of dentists make a night guard and give it to the patient in the hopes the patient doesn't come back, and 50% don't want anything to do with TMD because they know nothing works. And it's a black hole, and they don't want anything to do with trying to treat a problem that they have no solution for. Fortunately for my patients, fortunately for the industry, fortunately for dentistry, the solution has been discovered, which is the same solution that the orthopedic surgeons use at times, for the other joints in the body. If you have a bad joint that is inflamed and the inflammation is creating symptoms, the orthopedic surgeon's first line of defense is rest the joint. If you have a bad elbow due to tennis elbow, too much repetition, tennis elbow is too much repetition of the elbow. It can be due to tennis. That's why it's called tennis elbow, very common with tennis players. Where I come from, born and raised in Gary, Indiana, we did not play tennis. It was a blue-collar town, but on every night except Sunday night, there was a bingo game going on at a local church. And there was always a line of women who had a line of bingo cards, sometimes several lines of bingo cards every night at the churches, and they would go like this, up and down all night long, and they developed what we called bingo elbow. too much repetition of the elbow, which we now know, and the orthopedic surgeons taught me, sends an autonomic nervous system signal once the inflammation gets hold in the elbow itself to the central nervous system, telling the central nervous system, announcing to the central nervous system, I'm inflamed, I need help. And the central nervous system, lower levels of the central nervous system, you're not aware of this going on. It sends an autonomic nervous system signal back to the muscles that move that joint, in this case, the elbow, and says, tighten up, don't move the elbow. Orthopedic surgeons call this phenomenon joint splinting. And therefore, tennis elbow patients who have tennis elbow or bingo elbow complain of pain in the forearm all the way up into the wrist, because that is the origin and insertion of the muscles that move the elbow. That same phenomenon is the exact same phenomenon that makes the temporomandibular joint create the painful symptoms around the head and face and neck and upper shoulder girdle, because once this joint becomes inflamed, it sends a signal to the brain stem, says, I'm inflamed, I need help. The brain stem says, I'm going to help you out, sends a signal back down to the muscles that tighten the joint or move the joint, and they tighten up, but not all the same muscles on the same side on the same day. And we have several muscles across the face and lower jaw, and then neck, and then upper shoulder girdle, and the signals come down at various times depending on how long this inflammation has been going on. The longer it goes on, the longer the signal arrives to the brainstem, says, I'm inflamed. I've been inflamed now for 10 years. The brain says, I told you, hold the whole jaw tight, now hold the whole head tight, and then hold the whole upper shoulder girdle tight, and patients will complain of headache, jaw pain, neck pain, upper back and shoulder pain, even pain into the pectoralis muscles. And when the strap muscles on the side of the neck squeeze the brachial plexus, they'll complain of arm, hand, finger tingling, and numbness generated by inflammation within the joint, sending signals to the brainstem. That mechanism is undisputed. That is an undisputed mechanism of the autonomic nervous system, well known by orthopedic surgeons. If orthopedic surgeons had been left to treat the temporomandibular joint rather than giving it to the dentist to treat, this problem would have been solved 50 years ago or more. But it wasn't. And dentists are taught in dental school that this joint is unique, different. I have never had a dentist dispute that. I have never had a dentist tell me that's not true. I have talked to hundreds of dentists about that fact, and everyone shakes their head and go, yes, that's what I was taught in dental school. This joint, called the TMJ, is unique, complicated, very complicated, unique, different, and unlike any other joint in the body. And that is not a fact. Actually, this joint operates like any other joint in the body. It operates just like the hip and the knee and the elbow, and tennis elbow and temporomandibular joint disease is the same disease. That is a fact. So we have cracked the dam with this little article, and I wanted to bring it to your attention. And hopefully it will be widely promoted within dentistry. There actually is a solution for this problem, which takes the load off the temporomandibular joint, just like a set of crutches take the load off a knee, or a sling takes the load off of off of an elbow, because the orthopedic surgeon's first line of defense is to unload the joint of tennis elbow with a sling, or a bad knee with a set of crutches. And that's a fact. So if you unload the temporomandibular joint by unloading the posterior teeth, where 90% of the loads on the joint come from posterior teeth, you unload the joint, you decrease the inflammation, and because inflammation creates all the symptoms, then you have a solution, because the symptoms then go away when the chronic inflammation goes away within the joint. couldn't have said it in a more simple manner. So I invite anyone who wants to read the August issue of Dental Town. I must say that I totally disagree with parts of this article where these two doctors try to integrate temporomandibular joint disease with sleep apnea, and that these two diseases, one called sleep apnea and one called temporomandibular joint disorder, are related. They are not. They are two separate diseases. They try to put some loose logic into trying to make a relationship between sleep apnea and temporomandibular joint disease, but there is no science that shows that proves that. It is simply theory. It's just one of the disagreements I have with these two doctors, but I find it very interesting that finally a article has been written that openly admits that the night guard has no effect when used for the treatment of temporomandibular joint disorder. With that said, I appreciate your attention. I really do. Would love to have any feedback from anyone who'd like to contact me. I can be reached at tony@tmjservices.net. Our website describing how doctors can become network providers for this patented device and protocol, which unloads the temporomandibular joint. It is a patented device with a protocol, and that can be reviewed at our website, www.urbanektmj.com. I look forward to next Tuesday when I pick a topic to discuss. It could be anything regarding the temporomandibular joint, but I can promise you that the general underlying focus of the next topic will be TMD demystified. I am Tony Urbanek.